Republican Governor Mike Parson said it would be reckless for a judge to weigh in until the state takes action. Planned Parenthood's license for its St. Louis clinic is set to expire Friday unless the state renews it. But Parson said the state health department found a series of deficiencies at the clinic. He did not elaborate, citing an ongoing investigation, but the Missouri Department of Health and Senior Services later put out a news release saying concerns were initially raised after inspections in March. The agency cited at least one incident in which patient safety was gravely compromised. It also cited what it called failed surgical abortions in which women remained pregnant, and an alleged failure to obtain informed consent. The department did not elaborate on the allegations. Planned Parenthood Federation of America President and CEO Dr. Lena Wen said Parsons' comments are simply not based on medicine, facts, or reality. A court hearing on the group's lawsuit is set for Thursday morning. Governor Parson and his health department continue to move the goalpost on compliance issues and then threaten Planned Parenthood's license. Planned Parenthood has been responsive to every demand, including those that interfere with high-quality medical care, yet the governor continues to insist that our license is in jeopardy, said Dr. Colleen McNicholas, an abortion provider at Planned Parenthood of the St. Louis region. The lawsuit says the state wanted to interview 7 physicians, including medical fellows who no longer provide care at the clinic. It says 2 staff doctors agreed but the others did not, and Planned Parenthood can't compel them because they are not staff. The health department said the refusal of physicians to be interviewed obstructs the state's ability to verify that this facility is in compliance. According to the lawsuit, the health department won't decide on renewing Planned Parenthood's license until the investigation is complete. If the license is not renewed, the organization says Missouri would become the first state without a functioning abortion clinic since the 1973 Roe v. Wade Supreme Court decision. If the St. Louis clinic no longer can provide abortions, the nearest clinics performing abortions are in a Kansas suburb of Kansas City and in Granite City, Illinois, just across the Mississippi River from St. Louis. The Kansas clinic is about 260 miles, 420 kilometers, from St. Louis. Even before the latest legislation, Missouri already had some of the most restrictive abortion regulations in the nation, including a requirement that doctors performing abortions have partnerships with nearby hospitals. A total of 2,910 abortions occurred in 2018 in Missouri, according to provisional data provided by the state health department. That includes 433 abortions at 8 weeks of pregnancy and 267 at 6 weeks or earlier. Salter reported from St. Louis.